Welcome back. Partners in Sexual Health staged a protest in 4 provinces on Tuesday to raise awareness about the high teenage pregnancy rate in South Africa. The evidence-based non-profit organization advocates for access to better sexual and reproductive healthcare services in public health facilities. For more on this worrying conversation, we are now joined by Patsy de Lora, the CEO of Partners in Sexual Health. Patsy, thank you so much for joining us this evening. Now, you led a protest on Tuesday in 4 provinces to raise awareness about the high prevalence of teenage pregnancy in the country. What are the biggest contributing factors to the social ill?
In fact, there's quite a lot. Good evening. Thank you very much for hosting us. In fact, there's quite a lot of contributing factors when it comes to teenage pregnancy. One of them, which is quite significant to me, which we've done, Department of Social Development done the study in 2013 in terms of contributing factors to teenage pregnancy. One of the things that actually came out very clear for me out of that study was that our young people is in need of love and affection. So that's one key factor that is rarely talked about. So the normal factors that usually contribute to these teenage pregnancy is poverty is one, your economic circumstances is the second one, your education level is another one. So there's quite a lot of different factors, and then of course we believe that your parents should be the first and forefront sexual educators when it comes to sexual education. So within South Africa, unfortunately, it's not out there. And it's not that we as Partners in Sexual Health blame our parents. The problem is that our parents are not equipped and educated about these issues. And there's quite a lot of cry out for the past years when it comes to evidence that we need to actually educate our parents so that they maybe can contribute to the drop in terms of teenage pregnancy. So yes, there's quite a lot of different factors. There's access to services, just to name a few. I mean, if you look at the issues what's happening currently at our universities, it's shocking. You will see that our young people at universities have this tendency of sugar daddies, and sugar daddies obviously have an issue in terms of the fact that they don't have finances, and the fact that they do not have clothing. Society in terms of how our young people are these days want to portray themselves because of society, social media and so forth, actually have quite a lot of different effects on our young people. So yeah, there is a lot of factors that contribute to teenage pregnancy. But the reason why we've done the march on World Population Day is to highlight the plight that as much as there is a lot of factors contributing to teenage pregnancy, one of the biggest factors that we believe as Partners in Sexual Health, working with the people on the ground, and what we see on the ground is that access to services, youth-friendly services, is a major factor. And our march basically was to highlight the plight that we need to have youth-friendly services within our clinics to make sure that our young people have access to family planning.
I mean, Patsy, government implemented strategies such as making contraceptives available to people as young as the age of 12, but that's also proving to be inadequate.
Yes, indeed. Yes, I need to acknowledge, yes, government is trying. Government is trying. I think from our approaches is that I think we need to try harder. We need to try more. And I think the role players need to come together. Is that because you cannot put the Department of Health aside from the Department of Education. You cannot put the Department of Education apart from the Department of Social Development. All these key government departments need to come together, and we actually need to come out with the stakeholders like NGOs like ours, with outside partners. We need to come together and to actually discuss a proper strategy. Because what we tend to forget is that it's not a one issue alone. It's not because it's teenage pregnancy, people tend to think it's a health issue. It's actually not a health issue. It's a social issue. It's an educational issue. And what we picked up with being on the field is there is a lack of cooperation between these different departments. And because of that, our young people are suffering. So it's not a big fixed thing. So if we do not approach this comprehensively, integratedly, we will lose, like we are currently doing now. We are losing the battle. If you look at the current stats within South Africa when it comes to teenage pregnancy, it's a major concern. 90,000 young people getting pregnant in 1 year. I mean, come now. What are we saying? Research has been saying for years, 30 years now, Research have been saying that our access to services, the way we do things need to change. So when is the time that we're actually going to sit together, all the different role plays, and come up with a proper strategy? I think it's important for us to understand that we are playing with our young people's lives. These young girls drop out of school. These young girls, at the end of the day, lack education. It becomes, at the end of the day, a vicious circle. Now they need to get from DSD, they need to get some type of, what do you call it, not the 350 rands that the young people are getting these days. But what I'm saying is that these people depend on grants, and we need to break the cycle. And for us as an organization that focus on young people, that our belief is that we need to empower them. But once again, I'm coming back to the march. We are trying to highlight the need, and we are crying out for all stakeholders to come together so that we can come up with a proper strategy in terms of preventing teenage pregnancy. Yes, there will always be. It doesn't have to be at the rate it is currently at in South Africa.
Most certainly. And of course, these are very alarming numbers, Patsy. I mean, children as young as 10 are falling pregnant, and with data from 2019 showing that young children between the ages of 15 and 19 falling pregnant, and 55% of those end up in abortions that are quite often unsafe.
Indeed, and that's another challenge that we're having, is that, yes, our government, we are privileged in South Africa that we have laws and policies that actually make sure that our abortion services are accessible, or the abortion services are there within policy. In reality, when you actually come to implementation of our policies in South Africa, there's a huge lack. And not just in terms of the Abortion Act that was established, but in terms of all the SRHR policies when it comes to our young people. I mean, it's been said, and I don't even have to shy away by saying that South Africa are brilliant in policies, but when it comes to implementation, it's another level. And we critically need to look at how do we make sure that these policies that are signed off at national level actually filter down to the people on the ground, because policies are being designed, proclamated, signed off to make sure that to increase and make the betterment of our people and community of South Africa. But if these things, of these policies, do not come to the ground of the people or not being implemented on the ground, why are we then even come up with policies? So we really, as South Africans, and not just even government, I mean community as a whole, we need to come and stand together when it comes to teenage pregnancy. It is not a one person's what you need to do. It genuinely takes an effort of all stakeholders, all parties that need to come together and to address this genuine big concern. I mean, if you look at it, 1 in 4 young girls between the ages of under 20 is getting pregnant. It is a major concern, and it affects us all. It affects all South Africans, and we need to start to get together to figure out how do we curb this. From our side, and that's why I'm saying PSH is crying out. We need assistance. We need to come together. We need to make sure that this cannot continue, and we need to face the facts and come up with programs, implementation, interventions that actually address the needs of our young people in South Africa.
Patsy, just in closing, what's your take on the role that communities and parents and households need to play with regards to the moral aspect of young people participating in sexual acts at a very young age? I mean, we know that in the Zulu tradition, there's ukuhlolwa with the reed dance, and that is to encourage young girls to preserve themselves for as long as they can in order for them to only participate in sexual activities when they are old enough to make the right decisions for themselves. How much of a role does community and family play with regards to this ill?
I think, yes, indeed, we're very much aware, but I think we also need to be very sensitive in terms of people's cultures. However, if you look at the bigger picture in terms of our young people in South Africa, we are aware that young people as old as 10 years old are having sex these days, because that's why they're getting pregnant. If you look at the way our young people are evolving and the way they are doing things now, I mean, if you look at social media, things are evolving in a different level. And I think we need to adapt to the needs of our young people and speak to address the issues that our young people need. And yes, 15 years ago, 20 years ago, 30 years ago, if I look at myself, I mean, my mother never taught me about sexuality education, talk about sex and how do things happen. But the need is becoming it's such a huge cry that our parents need to be the forefront educators of when it comes to sexuality education. That is important. However, as I said previously, the problem is that our parents do not know how to teach their children on sexuality education. Personally, we started a program that's called Everything Starts at Home. Everything starts at home. But the problem is we need to assist the parents how to communicate with their children when it comes to sexuality and sex and to prevent these high teenage pregnancy rates. And as my mother used to say, it's in front of everybody's door. So, yeah, your child is my child, and we need to genuinely look into these things. How do we get to make sure that our young people are not sitting within a situation where they are today?
Most certainly. Patsy, thank you so much for your time, and thank you for the contributions that you're making in ensuring that our young people do have a brighter future. That was Partners in Sexual Health CEO Patsy de Lora.